As all of you know or should know, in America today, we spend twice as much per capita as do the people of any other country. That's extraordinary. Twice as much. Over $13,000 for every man, woman, and child. And that is a sum that is outrageous. Imagine, $13,000, family of four, $52,000. Not only is it outrageous, it is unsustainable. And yet, despite that huge expenditure, we remain the only major country on earth not to guarantee health care to all as a human right, leaving some 85 million Americans uninsured or underinsured. And that number, as you may know, has gone up recently as millions have lost the Medicaid coverage that was provided to them during COVID. Despite all of the money we spend on healthcare, this is quite unbelievable, not discussed enough. Our life expectancy, how long we live, is considerably lower than almost any other wealthy nation. And in many parts of our country, life expectancy is actually going down. It's getting lower. Incredibly, and this is, again, it's just an extraordinary fact, not discussed terribly much. The gap in longevity, how long we live, between the rich and the working class is now at least 10 years. In other words, poverty is a death sentence. In America today, we pay by far the highest prices in the world for prescription drugs. While the pharmaceutical industry reaps huge profits, makes tens and tens and tens of billions of dollars every year, and they pay their CEOs exorbitant compensation packages, 1 out of 4 Americans cannot afford the prescription drugs their doctors write. Further, one of the major causes of the escalating cost of hospital care and insurance premiums is that many of the new drugs coming onto the market for cancer and other diseases now cost over $200,000 a treatment. $200,000 a treatment. And as bad as our overall healthcare system is, our primary care system is even worse. Today we have major shortages of doctors, nurses, mental health providers, dentists, and pharmacists, and those shortages will only grow as a result of the COVID burnout that many providers experienced and the aging of our healthcare workforce. As a result, tens of millions of Americans, even those with decent health insurance, cannot find the medical care they need in a timely basis. Some Americans have to wait months to get a medical appointment. Others have to travel very long distances to find a doctor. For all of these reasons, and many more, I have introduced Medicare for All legislation repeatedly as a member of the House and the Senate. Now, what would Medicare for All do? Why do I support it? Quite simply, Medicare for All would improve and expand current Medicare to cover health care for every man, woman, and child in this country, not just the elderly. That comprehensive health care coverage would mean an end to out-of-pocket expenses. No more premiums, no more deductibles. An end to out-of-pocket expenses and, unlike the current system, would provide full freedom of choice regarding health care providers. In other words, you walk into a doctor and you don't have to take out your pocketbook, you don't have to take out your credit card. And in addition to all of that, there will be no more networks which deny you your choice of doctors. And when I talk about Medicare for All being comprehensive, it would cover dental care, vision, hearing aids, prescription drugs, and home and community-based care. In other words, you ready for a radical suggestion? It would do precisely what the American people want. Would a Medicare for All system be expensive? Yeah, it would. But while providing comprehensive health care for all Americans, it would be significantly less expensive than our current dysfunctional system because it would eliminate an enormous amount of the bureaucracy, profiteering, administrative costs, and misplaced priorities inherent in our current for-profit system. Under Medicare for All, there would be no longer armies of people billing us. Do you know how many billions of dollars a year we spend Are people writing us bills and hounding us to pay those bills? There would not be costs of insurance people hounding us to pay our hospital bills, driving us crazy in the process. This not only saves substantial sums of money by doing away with all of these administrative costs, but will make life a lot easier for the American people, who would never again have to fight their way through the nightmare of insurance company bureaucracy. And I think everybody has gone through it. I know people have PhDs who can't figure out what they're entitled to and have to argue with half the world to get what they need. In fact, the Congressional Budget Office estimated that Medicare for All would save Americans almost $700 billion a year. Now, trust me, I know, because I've experienced the 30-second ads from the insurance companies and the drug companies that have told us that if Medicare for All becomes the law, your taxes will go up. But what they don't tell you in that 30-second ad is that under Medicare for All, you will no longer be paying premiums, deductibles, and co-payments to private health insurance companies, and there will be no more out-of-pocket costs. And what they certainly won't tell you is that Medicare for All will save the average family thousands of dollars a year. In other words, yeah, you may be paying, depending on your income, more in taxes, but no more premiums, no more co-payments, no more